Welcome back in. Stroke is one of the leading causes of death and disability, but knowing the warning signs, understanding your risk factors can save lives. Here this afternoon, so we learn more about that, is Julie Goins-Whitmore and Dr. Stacey Hoffman with Mercy Health. Welcome to both of you.
Thanks.
Dr. Hoffman, start with you. Let's talk about what stroke exactly is. People hear about heart attack and stroke. You don't want to get either one of them, but what are the differences and so forth?
Sure, they're actually kind of closely linked, but a stroke in particular is when the blood flow to the brain gets interrupted, either because there's a clog or a blockage, or because the blood vessel has opened and the blood is leaving the vessel and going where it's not supposed to go. So then the brain's not getting the oxygen and nutrients that it needs.
And to both of you, what are some symptoms of this if you're experiencing what is happening there?
So it's really pretty simple. We like to use the acronym BFAST. So sudden onset of B for balance. So you feel off balance, maybe a little wobbly, a little drunk perhaps. So that's the B. The E is eyes, double vision, blurred vision, maybe some areas of blindness in your field of vision. And then F for facial drooping. A for arm weakness, speech, difficulty speaking or understanding what's being said to you. And then the T is time to call 911.
Well, and also though, do you always realize it's happening to you? I know I've heard stories where yeah, when mom didn't look good, she had no idea what was going on, but she just didn't look good, so we called 911 right away.
Yeah, and that's actually the wisest course because it really is so dependent on what part of the brain is affected by the stroke, what the symptoms will look like.
That's crazy. Mm-hmm. So you deal with rehab with you get the patients after they've had the stroke.
Correct.
And you help deal with them and getting on the road to recovery. What are some of the symptoms? What are some of the fallout of getting a stroke?
Go ahead.
So a lot of times the customary thing that you will see is weakness on one side of the body, and that can have a significant impact on people, especially if it's affecting their dominant arm or hand. And then the speech difficulties can be a real challenge, either getting out the word you want to say or understanding the things that people are saying to you. Swallowing can be affected, vision can be affected. It can affect a lot of areas.
Julie, you work with rehab a lot. What do you work with? What are some exercises or what are some programs that you've seen over the years in helping turn the corner with people?
Well, really, stroke rehab, and Dr. Hoffman can be, speak more to this than I can, but your rehab doesn't stop after a week. Recovery doesn't stop after a month, 6 months, even a year. Recovery is ongoing for the rest of their life. And some people are working at it even 20 years later. And we have some good resources locally, but it takes a lot of work to get back to where you were.
Frightening thing is that you're talking about the ages of people that can get a stroke. It's surprisingly young. Mm-hmm. Talk about that.
Yeah, it's very true because classically we think of the risk factors of blood pressure or diabetes or things like that. Those affect typically older people, but I have seen strokes happen in people as young as 18. If there's something that happens to one of those blood vessels and they bleed out into the brain, that technically is a stroke, so it can affect a variety of ages.
What are good things to do? Well, heredity is a good part of it. Mm-hmm. Life, some of the things you do, what are some ideas you have as far as preventing stroke, being aware of it, of your potential to have it?
Well, I mean, that's a great point you bring up because 80% of strokes are preventable. 80%. So what we need to do is watch our blood pressure. So if you have high blood pressure, it's not the end of the world. You just need to monitor it from time to time. If you're prescribed a medication, take the medication as prescribed by your provider. Just don't stop it abruptly. If you have high cholesterol, take your statin medication. If you perhaps have side effects from any of the medications, communicate with your provider and talk about those side effects so that we can get you on a replacement instead of just discontinuing it on your own.
We have about 30 seconds left, Doctor. What improvements have you seen in medicine in the last 10, 15 years in detecting stroke and also helping prevent them?
Oh gosh, the technology is so advanced. We're catching them earlier through awareness, which is a key component of it. We're doing removal of the clots now, and so more people are surviving strokes, and they're surviving them with less deficits, and that gives them a better opportunity to do rehabilitation and live life after stroke.
Well, Julie, Doctor, thanks you so much for being here today. Appreciate it.